is a common cause of pneumonia. Infection occurs when the bacteria accumulate in the alveolar space. Streptococcus pneumonia can produce meningitis, sinusitis, multistemia, bacteremia, and endocarditis. This organism is the most common cause of meningitis in most all age of group. Epidemiology of Streptococcus pneumonia. Most infections by Streptococcus pneumonia GBS or Streptococcus agalactiae. The only species that has the group P antigen is Streptococcus agalactiae or GBS. GBS has a large colony with a number of metahemolysis. Studies show that 1–2% of GBS isolate are non-hemolytic. The major virulence factor of GBS is a capsular polysaccharide. Currently, 10 different cell type or capsular polysaccharide have been documented in GBS. 1A, 1AB, 2, 3 to 9. These five serotypes are responsible for more 85% of severe infection or invasive infection in newborns. Studies show that these organisms can colonize in 10 to 30% of pregnant women in vagina or rectum. Colonization in rectum or vagina or rectovaginal colonization is a primary risk factor for development of invasive disease in newborns. The studies show that colonized GBS pregnant women are more than 25 times likely to deliver infant with invasive disease such as meningitis, such as pneumonia, than culture negative women. For this reason, according to the CDC guideline, all pregnant women should be screened in 35 and to 37 weeks of gestation. And culture positive women should be received antibiotic. Recently, meta-analysis showed that approximately 10% of Iranian pregnant women are colonized with GBS in vagina or rectum. Neonatal disease or infection by GBS are divided to category or two groups. EOD, early onset neonatal disease, and LOD, or late onset disease. EOD disease is acquired by vertical transmission from a colonized mother. And this form of disease occurs in the first week of life. The major clinical manifestation of EOD is bacteremia, pneumonia, and meningitis. these three serotypes responsible for EOD. The studies show that serotype 3 alone responsible for 37% of EOD cases and 53% of LOD. LOD can result from horizontal transmission from other mothers, from by hand of clinician. This form of disease occurs in the 7 to 90 days of the week. And this form of disease, the major clinical manifestation of LOD is a bacteremia and meningitis. In this form, in LOD, we cannot see a pneumonia. Pneumonia is a common clinical manifestation in EOD. Diagnosis of GBS. Microscopy. A gram stain of CSF fluid has a high sensitivity. And should be used. Culture is a gold standard. And has a sensitive and has a high sensitivity for identification of GBS. For this purpose, Limbras is used. Limbras is a selective media for GBS. This media is supplemented with colistin and nalidixic acid. Colistin and nalidixic acid inhibits the growth of normal flora in the vagina and rectum and permit to GBS to grow in this media. As you know, many normal microbiota present in the vagina and rectum. Colistin and nalidixic acid inhibit the growth of the normal microbiota and permit to GBS to grow. In this week of gestation, all pregnant should be screened, and from these pregnant women we take a sample, clinician should we take a sample from the vagina and rectum of pregnant women in this week of gestation. Recently, nucleic acid-based tests such as PCR, polymerase chain reaction, has developed for detection of GBS in vagina or rectum. This test, PCR, has a high sensitivity, and this test is a rapid. Like as gas, penicillin is a drug of choice for treatment of infection by gas. Combination therapy with penicillin and aminoglycoside is recommended for serious infection. And in patient who has allergy to the penicillin, cephalosporin or vancomycin is recommended. No vaccine is available against GBS. Streptococcus pneumonia or pneumococcus. This organism is an encapsulated gram-positive coccus. Like as GBS, capsular polysaccharide is a major virulence factor for pneumococcus. This organism is a fastidious microorganism, and the virulent strand are covered with a capsular polysaccharide. Currently, 90 serotype or 90 capsular type have been identified in Streptococcus pneumoniae. This organism has a several virulence factor. Some virulence factor has an important role in colonization and migration, such as pneumolysin, secretory IgA protease, and surface protein atrazine. Some virulence factor have an important role in tissue destruction, and some of them have an important role in phagocytic survival. As you can see, phenolysine has an important role in this stage, and in colonization and migration. Capsule is a major virus factor for these organisms. For example, secretory IgA protease disrupt IgA. Phenolysine activate classic complement pathway. Capsule has an antiphagocytic activity. Streptococcus pneumonia is a common cause of pneumonia. This organism multiply in the alveolar space, and Streptococcus pneumonia is the most common cause of bacterial meningitis in old age group. This organism can produce sinusitis, otitis media, bacteria, and endocarditis. Most infections by Streptococcus pneumonia are endogenous because this organism can colonize in healthy adults in the nasopharynx or oropharynx. Most infection occurs when the Streptococcus pneumonia disseminated from the oropharynx or nasopharynx to other tissue. Colonization is highest in young children, and elderly are greatest risk for meningitis. This is due to the pneumonia, Streptococcus pneumonia, more common in cold months. Microscopy. Gram stain of the sputum samples is rapid way to diagnosis of the pneumonia and meningitis. Under the microscope, they appear in Streptococci. You can see. Gram stain is highly sensitive, like as culture, unless the patient has been treated with antibiotic. Culture. Sputum samples should be inoculated on the selective media. The selective media for pneumonia, Streptococcus pneumonia, is a blood agar supplemented with gentamicin. Identification. Streptococcus pyogenes is susceptible to bacitracin, but this organism is susceptible to octocin. You will be perform this test in my lab classes. This is Streptococcus pneumonia. This organism is susceptible to this is octocin. In this slide, you can see gram stain smear. This is a gram stain smear of blood culture. We can see a diplococci and also PMN, such as neutrophils. This is a gram stain smear of purulent sputum or pus containing. You can see the neutrophils and diplococci. Penicillin is a drug of choice for treatment of sensitive strains. Vaccine is available against Streptococcus pneumonia. Immunization with 27-valent vaccine is recommended for adults. However, the effectiveness of this vaccine is controversial. Enterococcus. Enterococci are a facultative and aerobic bacteria. They can group optimally at 35 centigrade.
And presence in oxygen and without
Yes,
oxygen.
yes. The colonies of Enterococci are non-hemolytic, alpha and gamma hemolytic. For example, I isolated the Enterococci from a urine of patient. In some patient, we can see beta hemolytic, but in another patient, I isolated from the urine. We can see a beta hemolytic. In different clinical sample, we can see different hemolytic pattern, alpha, beta, and gamma. Two species are responsible for most human infections. Enterococcus fecalis and faecium are responsible for most human infections. Three features help us to distinguish Enterococci in laboratory. They can prove the presence of the
6.5 NaCl.
yes, concentration of
Salt.
They can tolerate 40% of mild salt, and they can hydrolyze scoline. You will perform these tests.
What's the pili salt? Pili salt. Pili salt.
Why the scoline salt? Why the scoline salt? When the organism, this organism can tolerate the salt. Like as NaCl, this is a salt. And you will perform this test with molecular classes.
Okay.
Virus factors. Enterococci, unlike Staphylococci, unlike Streptococcus virus, do not have many virulence factors. The major virulence factor for Enterococci is an antibiotic resistance. Antibiotic resistance is a major virulence factor for Enterococci. However, this organism can produce gelatinase, pheromone, cytolysine, carbohydrate atrazine, and aggregation substance. Among them, this is very important. This is a major virulence factor for Enterococci. Enterococcus faecium and fecalis are a common cause of the UTI, wound infections, bacteremia, and endocarditis. Treatment of the infection by Enterococci. Combination therapy is performed for treatment of serious infections. For example, aminoglycoside and beta-lactam. Aminoglycoside inhibit the synthesis of protein, and beta-lactam such as ampicillin, penicillin, cephalosporin, vancomycin inhibit the cell wall synthesis. Unfortunately, many strains of faecium and fecalis are currently develop resistant to these antibiotics. Develop resistant to aminoglycosid and ampicillin and vancomycin. Currently, newer antibiotics have been introduced and used for treatment of infection by resistant strain. Linezolid, streptomycin, tigecycline, and quinoperistine dalfopiristine are recommended for treatment of infection of enterococci that are resistant to the ampicillin, vancomycin, and aminoglycoside.